are several tissue sources. When we're going to be using fresh autologous stem cells, there are a few different tissue sources that we can obtain the stem cells from. Normally we use bone marrow, and those are the most common. Bone marrow, we use adipose tissue. We could use probably blood in some cases, but those are the most common. Now, we could also use cord blood. It could be from the person's own cord blood in storage, or it could be heterologous cord blood, meaning it could be from somebody else, the cord blood. Now, the most common is bone marrow and adipose tissue. Why? Because of the counts. In children, we have a lot of good young progenitors in bone marrow. It's very populated. Those cells are very active, they're very young, and normally they're very successful. In a child, it will be a little bit more difficult to obtain adipose tissue in quantities big enough to obtain a good count of cells. Now, in adults, normally we use either adipose or bone marrow, and that's mostly related to the age of the patient. If it is a patient more than 70 years old, normally we tend not to use bone marrow because at that point on our biology, the count of stem cells in the marrow has decreased considerably. So we will try to obtain cells from the adipose tissue.